All right, so today we're going to talk about a disease that, yeah, you've definitely heard of, but you might not really get just how big of a deal it still is. This is an ancient killer. It's been with us for literally thousands of years, and yet it's still a massive global threat. So let's just dive right into the world of tuberculosis. So let's just kick things off with a big question. What if one of history's oldest, most notorious killers isn't actually history at all? What if it's right here, right now, infecting millions and millions of people year after year? Because, well, that's exactly the reality we're dealing with.
And this number, this is why it matters so much. 1.5 million. That's how many people are estimated to die from tuberculosis every single year. I mean, that's a staggering number for a disease we kind of think of as a thing of the past, right? So what is this invisible threat really?
Okay, so let's start with the absolute basics. Let's get to know the invader itself. What exactly are we up against? And how does it even work?
At its core, tuberculosis, or TB as most of us call it, is an infectious disease. It's all caused by this one little bacterium, Mycobacterium tuberculosis. And yeah, it's famous for attacking the lungs, that's its main target, but it's actually a pretty versatile enemy. It can also go after your kidneys, your spine, even your brain.
And how it gets around is almost deceptively simple. It's airborne, so when someone who has active TB in their lungs coughs, or speaks, or even just sings, they're releasing these tiny bacteria into the air. And then someone else just has to breathe them in. You can see why it spreads so easily in crowded places with poor ventilation.
But, it's just as crucial to understand how it doesn't spread, because this is where a ton of harmful stigma and fear comes from. You cannot get TB from shaking someone's hand. You can't get it from sharing a meal or touching a toilet seat. It's just not that kind of germ. And knowing this is absolutely key to treating people with compassion instead of fear.
Okay, now to really truly get a handle on tuberculosis, you have to understand its two different personalities, its two different forms. This is probably the single most critical concept of this whole thing, the difference between latent TB and active TB.
So here's the easiest way to think about it. Latent TB is like a sleeping giant. The bacteria are inside your body, sure, but they're dormant. Your immune system has built a wall around them. You feel totally fine, no symptoms, and you are not contagious. Active TB, on the other hand, well, that's the awakened threat. The giant is awake. The bacteria are multiplying, you feel really sick, and now you can spread it to other people. But here's the key. Both forms need treatment, just for totally different reasons. Now brace yourself for this next number. It's estimated that a quarter, 1/4, of the entire world's population is just walking around with latent TB. Yes, you heard me right. 1 in every 4 people on this planet is carrying that sleeping giant inside them. It's mind-boggling. So what's the actual risk? Well, if you have a healthy immune system, your lifetime risk of that latent infection waking up and turning into active disease is about 10%. That risk, though, it skyrockets for people with weakened immune systems, and that's a huge piece of this global health puzzle.
And that brings us to the bigger picture. We've seen how it works inside a person, but what does that look like when you zoom out and look at the whole planet?
Every year, about 10 million people around the globe go from having that sleeping, latent TB to getting really sick with active TB. To put that into perspective for you, that's like the entire population of New York City getting sick with this disease, every single year. And the World Health Organization really puts it in stark terms with this reminder. For all the attention that COVID-19 rightly got, TB has been right there behind it, this silent, persistent killer. It is a pandemic that never really went away. So what does it actually look like when that sleeping giant wakes up? The symptoms of active TB are just awful. We're talking a really bad cough that just won't go away, serious pain in the chest, and that classic terrifying sign of coughing up blood. But it also just wrecks your whole body, causing this deep fatigue, weight loss, fevers, and terrible night sweats. Now, I know that all sounds incredibly bleak, but there is good news, there is hope. So let's pivot away from the threat for a minute and look at the response, at how we actually fight back. And this right here is the single most important message to take away from all of this. TB is treatable and it is curable. We have the medicine, we have the tools to beat this disease. The real challenge is just getting that care to every single person who needs it. And that path to a cure is really well established.
It all starts with a diagnosis, usually a skin test, a blood test, or an X-ray. Then comes the treatment itself, a course of several powerful antibiotics that you have to take for up to 6 months. But the absolutely most critical part is number 3, adherence. You have to take all the medicine every single day exactly as you're told. Because if you stop early, well, you're basically allowing the toughest, meanest bacteria to survive, and that's how we get an even bigger problem.
And that brings us to the final and honestly the most challenging chapter in this ongoing fight, the rise of drug resistance.
Drug-resistant TB is pretty much exactly what it sounds like. It's a version of the bacteria that has literally evolved to survive our best drugs. This is what happens when treatment gets interrupted or the wrong medicines are used. And what you're left with is a disease that's way more deadly and much, much harder to treat. And the scale of this crisis is just staggering. We're looking at about 500,000 new cases of drug-resistant TB every single year. But here's the truly devastating part. Only about 1 in 3 of those people actually gets access to the right treatment. The result is a disease that's more difficult, way more expensive, and takes so much longer to cure. You know, when you step back and look at it, tuberculosis has been evolving right alongside humanity for thousands of years. It's an ancient disease, and it has proven to be incredibly, incredibly resilient. And all of that leaves us with one final urgent question. Is our modern medicine smart enough? And more importantly, is our global commitment strong enough for its future?